My name is Aaron Sui. I practice Chinese medicine and acupuncture. It's been almost 30 years now. And tonight I would like to share some of the healthcare products from Atomy, okay? Here we go. Okay, we're going to start with the calcium-magnesium ratio. Usually, the calcium-magnesium ratio is 2:1, okay? And why it's important? Because calcium and magnesium is, it's like a yin and yang in Chinese medicine, okay? Calcium is found mostly outside of the cell, and magnesium found in the inside of cells. And calcium excites and magnesium calms. And calcium contributes to clogging, and the magnesium contributes to blood flow. Calcium is found in the bones, magnesium found mostly in soft tissue. And calcium helps muscle to contract, magnesium helps muscle to relax. So if they're not balanced, that means sometimes you could have the muscle spasm. So then what you need to take is magnesium. But if you are taking magnesium and calcium together, 2:1 ratio, then you won't have the problem. So for those of you who who already experienced some leg cramps at night, and especially in the calf muscle, this is the formula that you want to take, okay? And for those of you who cannot sleep well at night, you can also take this. And for those of you who have minor constipation, then you can try this also, okay? Okay, so Atomy has plant calcium, mainly from the plant bases from the ocean, okay? And this is a 2:1 ratio, and there are other vitamins and minerals along with this. And I'll tell you a little bit about why they have to be all right here, okay? Have you if you are a milk drinker, you know, when you buy the milk, some milk has vitamin D in it. That's because without vitamin D, the body cannot absorb calcium. That's why vitamin D is in your milk, okay? And magnesium is another thing that you need magnesium to absorb better. Without the magnesium, the calcium can go to your kidneys, ready to be excreted from your body, and sometimes you could have a kidney stone. So be careful, don't just take calcium. And when you read the label, you're going to see calcium, magnesium. Okay. And also there is other ingredient there. It's a cornstarch, and people are asking me, I don't like starch because that make me fat. So you have no idea what you don't like. The cornstarch is absolutely necessary to bind the calcium magnesiums together, okay? And also what it does is disintegrate, you know, that means the calcium magnesium will not be dissolved until it reaches to certain areas of your body, especially in the stomach, and sometimes it bypasses the stomach. It will dissolve in the small intestine, some will dissolve in the large intestine. That's because, you know, if it dissolves in some of the areas, will not be absorbed, first of all, and cannot be digested. Yeah, so that's why the cornstarch is absolutely necessary. Some people have the wheat allergies, so the corn is compared to wheat or you know, anything that has a gluten is one of the safest. So this has a two function, like I said. It binds the calcium or the medication, and also this integrant. Okay. Okay. Since I practice Chinese medicine, I like to introduce a little bit about the Chinese medicine. In Chinese medicine, we also use calcium and magnesium in the form of longu and muli. Longu is a direct translation is the dragon bone. Where do you find the dragon bone? Well, in China, they call it dragon bone because it's old calcium bone. It's actual the fossil they found. So they've been using this form of the mineral for very, very long time. If it's hundreds of years, maybe thousands of years. And another one is muli. Yeah, the muli is oyster shell. So some calcium form is the oyster shell. If you buy the calcium in the market, you will find the source of calcium is from oyster shell, muli. So in Chinese medicine, we used a longu muli for a long time. And the usage is not like, the modern usage, just the calcium, magnesium. Longu muli, there is also famous herbal decoction. It's called guizhi jia longu muli tang. The guizhi is cinnamon, and plus longu and muli, and both of them are calcium. So the formula is to help people with the anxiety, irritability, nervousness, and insomnia. So from here, you can see calcium, magnesium can help some of those symptoms. If somebody is overly anxious, overly irritable, nervous, cannot sleep at night, try it. Okay. Okay. And three types of magnesium in the Atomy plant calcium. And there is a magnesium citrate, magnesium oxide, magnesium amino acid chelate. Okay. The magnesium and the citrate and oxide, they all work for constipation. Okay, if you take little too much, you could have a loose bowels. Okay, if somebody says, oh, after I take plain calcium, I have a little loose bowel or diarrhea, maybe you took too much. So you can reduce a little bit. And also for those of you who have acid reflux, you could also try this, because most of anti-acid medications are calcium-based. Okay, and magnesium amino acid chelate, this one is especially good for muscles and the nerves. However, if somebody has kidney disease, then you have to talk to your doctor, okay? Because this can cause more issues. Okay, so there are other, like I said, there are other the vitamins and the minerals like calcium, magnesium, vitamin D, vitamin K, zinc, copper, manganese, and boron. And I'm going to tell you a little bit about more about the vitamin D, because I think we're going to have a new formula from Atomy that is a vitamin D. The calcium, magnesium, vitamin D. It's a very important combination, because in order to for the body to absorb a calcium better, we have to have a vitamin D, and we also need to have a magnesium. Okay, so magnesium helps to regulate calcium transport and stimulates the secretion of calcitonin, a hormone that aids in the flux of calcium into the bone. So it's not just the absorption, but also transport the calcium into the bone. Okay, and the vitamin D is required to promote calcium absorption, and which helps to maintain healthy bones and teeth. Okay, so D, I'm going to talk a little bit about the D because we are making vitamin Ds, believe it or not. And there is one vitamin that, I talked a lot that we used to make, but not anymore, because I think we are access to that, fruits and the vegetables, they are rich in vitamin C's. Yeah, so oranges, apples, and so on. So C, we don't make vitamin C's, but some of the animals are still making vitamin C. I talked about that, many times in the past. The rats and the dogs and the cats, they all make their own vitamin D. So guess what? They don't usually eat the fruits and they don't like to eat some of the vegetables because they are making their own the vitamin C's. By human, we like to smoothie all the fruits and vegetables and stuff, because we need vitamin C. And the vitamin D, however, we are making vitamin D's. It's very important because if we don't have vitamin D, then we could have spinal the problems, the spines and getting weak, and then we get hunched. Yeah, so we have to have a vitamin D. So then what is the best? Is the sunlight is the best to get the vitamin D or supplements? Okay, after industrialization, we become people start to live under the roof. Okay, we don't go out a lot, and also our skin got so sensitive, and we are afraid of the cancer. So my recommendation is we try both. Okay, if you don't, if you're afraid of going out to get vitamin D or sunlight, then I'll tell you when to go out. When is the best time to go out, and when is the best time to take take a vitamin D. And also, by the way, vitamin D is, the nature type is produced in the skin from a universal present form of cholesterol. Okay, vitamin D is not water soluble vitamin. It is the oil soluble. Okay, it's oil based, and so you have to have a cholesterol to make vitamin D's. So if you're a vegetarian, so then you need to take some fat from good source, okay? Because it is you absolutely need cholesterol to make your own vitamin D's, okay? Here. So what time is the best time to take vitamin D? At noon with the meal, okay? Why at noon? Because noontime we get most UVB, right? UVB is necessary to make vitamin D's. However, UVB can cause skin cancers too, okay? So if you're afraid, really, then you take at noon with the meal. So that's the best time, because that's the best time actually to get the full sunlight UVB and to get the vitamin D. What time is the best time to sun exposure and how long? It's between 7 a.m. to 11 a.m. Okay, because at 12 o'clock is the sun is at the top of you, and probably it's a little too strong. So the best time, 7 a.m. maybe, it's just sunrise. Okay, sunrise to right before the lunchtime is the best time. The morning sun is the best time, and you don't get exposure to too much sun, and so you worry about the skin cancer. And for how long? 20 to 30 minutes. Okay, and how to improve vitamin D absorption. For better absorption of vitamin D, you must include vitamin K, you see. So we have vitamin K in the plant calcium, and magnesium, zinc, see? So in order to absorb vitamin D better, we all need vitamin K, magnesium, and zinc in your diet. So this in one formula, it has everything, okay? How much we have to take, it depends, okay? If you are living where there is no sun, like a northern European countries, probably you need more, because if you don't take more, they found out, people could easily get depressed. That's why people from northern European countries, they all go to where? Malaysia, Philippines, and Indonesia, those areas during the winter time. It's not just because of the coldness. It's because, they need to get the sun, exposed to the sun. Okay, so the next one, I like to talk about the iron, because this is also another new product that we have. So iron is very important, and because after we found the metal, skillets, and the people really don't need much of iron because the cookingware is already metal, and if you scrape, it's the same iron actually. When you cook, those the skillets. Okay. However, it depends on the some of the conditions, and probably you need extra iron. Okay, especially for those who have heavy menstruation, heavy cycle, then probably you need extra. And also for a pregnant woman, probably need extra. Okay, so this is one of the supplement that is approved for pregnant women. So you could actually recommend this to a pregnant woman. Okay, so what are the food that are rich in iron? Okay, grains, shellfish, broccoli, Brussels, and the dry fruits, and green beans, green peas, the leafy greens, poultry, cooked spinach, the meat, especially the red meat. And for those who have a low iron count and a low hemoglobin, and they don't eat meat a lot, and sometimes I tell them, well, for this time only, for those, especially with the heavy menstrual bleeding, I call it the steak therapy. It really helps, and especially after heavy cycle, if you feel dizzy, and low energy and so on, sometimes you need some red meat. Okay. Okay, so this is another Chinese medicine. We use iron, actually. It's not the same iron, however, it's the iron from magnetics. So we use a magnetics. It's a powder, magnetic powder, into the formula. Okay, so if you can see, it's just the cross reference, just for you to understand where we use in Chinese medicine. So we use for agitated heart and the spirit with restlessness, palpitation, insomnia, tremor, dizziness, and vertigo. You see? and in patients with the indeficiency with the yang rising. What's that mean? Indeficiency with the yang rising. So people with, let's say, who just had the heavy bleeding cycle, and then the husband made her get angry. So that's a yang rising and the indeficient. And so lady could have a restlessness, a palpitation, insomnia, irritability, dizziness, a vertigo. So that's what it means, indeficiency with the yang rising. And if you look at down here, and the kidney and the liver indeficiency with the impaired hearing or deafness. Okay, tinnitus. Look at tinnitus or visual disturbance. So iron, sometimes we use this the magnets for with the longumuli, those calciums and magnesiums for tinnitus, especially if somebody is yang type, easily get angry, agitated. Those people with the tinnitus, you can try those. Okay. And chronic asthma due to kidney unable to grasp the qi. What's that mean? Kidney unable to grasp qi. That means shortness of breath. So if you tell a patient, take a deep breath, and they cannot take a deep breath because the kidney is so weak. So in the half of the way, they will cough a little bit because they cannot take a deep breath. That means a kidney cannot grasp the energy, the qi, the breath. Okay. Iron deficiency symptoms. Of course, the fatigue, shortness of breath, shortness of breath, right? Weakness, headaches, restless leg syndrome, poor focus, heart palpitation, right? It's very similar, right? Yeah. So if if anybody that you can recommend. But definitely if they're saying, oh, I have this disease or this diagnosis, then you don't want to recommend directly because you don't diagnose and you don't prescribe. Okay, but if somebody says, oh, after a cycle, I feel shortness of breath, I feel fatigue, and restless leg syndrome. Restless leg syndrome, by the way, is when you're sleeping, the leg is just wants to go out, wants to come out of your bed. So that's restless leg syndrome. Okay. So then, why don't you try the Atomy iron and calcium, magnesium, okay? The next one, I like to talk about the coenzyme because some of them are the enzyme. We understand the enzymes, right? We have pharmaceutical, that is the enzyme to digest your food. So especially if you eat too late at night, so make sure take one. That will help you. And also in the lunchtime, after lunch, if you feel sleepy, okay, try this, the enzyme also, pharmaceutical. But what is a coenzyme? Because, there is something called coenzyme. And what's the difference between coenzyme and the enzyme? So enzyme, as you know, it breaks down your food into small pieces so that your body can absorb. Okay, coenzyme is it's a kind of enzyme, but it's not the protein based. And the coenzyme is going to help enzyme to do further. Okay, so it helps enzymes, and it has a catalytic reaction. Okay, that means it makes it mix with the enzyme and make the particles get more smaller and able to absorb better, and also transfer and into produce more energy in your system. So why I'm talking about the coenzyme enzyme here, because we have vitamin B complex. the vitamin B complex are the coenzymes. It's very important in energy metabolism. So after you take vitamin B complex, sometimes you'll feel, oh, I feel a little less tired, right? Yeah. So you can try B complex vitamins. When is the best time to take this? I will say in the morning or lunchtime, because I tried at the dinner time, and after I took this, I was awake. my energy was high, and so probably you like to try in the morning, especially if you have sensitivity to some of the supplements, and if you have the sleeping issues. So then you like to try during the day instead of at night. So vitamin D is crucial to make is crucial as a coenzyme, and also produce more the energy. The one thing that I would like to mention with the B complex, I found out after I take a vitamin B complex, my appetite has increased. So, whatever I eat is so tasty. If you are easily gaining weight, so definitely you want to avoid the nighttime taking this. Take during the day. Okay, so you can see the Atomy has a vitamin B complex, and with many other B vitamins. And I like to go over just the one thing, the B12, because a lot of elderly people are taking this extra, and also they even get the injections, right? So because it requires for normal red blood cell formation, and also neurological function and DNA synthesis. So, when the elderly people complains that I have pins and needles in my fingers, and, numbness, and, I feel weak and tired, my arm is weak. That's why the doctor prescribed a vitamin B12. So what is a vitamin B complex good for? B vitamins plays a vital role in maintaining good health and well-being, everybody knows, and may help prevent infections, help support or promote cell health. Okay. Yeah, we can go, we could, and here, and it breaks down the carbohydrates and transporting nutrients throughout the body. Symptoms of vitamin B12 deficiency: pale and yellow tinge to your skin. So your facial complexion is a little yellowish, and a sore and a red tongue. And sometimes, when you look at the tongue, it's like a glossy tongue. It's like a no coating, it's a glossy, and it looks very painful. Sometimes they also have a sores in the tongue, and the mouth ulcers, and pins and needles, like I said, needles in your fingers, and the numbness. And here, depression and anxiety, irritability, disturbed vision, and changes in the way that you walk and move around. So it's kind of all, part of it are the neurological conditions. So that is the vitamin B12 deficiency. Okay, so that's all for today.